This is the Plastic Principle.
All right, everyone. Welcome to the Plastic Principle podcast. And I am very happy to introduce our guest today. We have a very special guest, Dr. Eric Snyder. He is an emergency room doctor specialist. And is that the right way to?
Yeah, I mean, you can call us anything you want, really. Emergency medicine specialist, ER doctor, you know.
Right. You guys are back in the forefront of everyone's mind because The Pit just won.
That's right.
Yeah,
That's
yeah.
right. No, it was actually very interesting to watch that. Obviously, it's dramatized, right? Otherwise people wouldn't watch it. But it is, there's a lot of ER docs that worked on that show with Noah Wiley, and actually one of my close friends was one of the nurses on the show, and it's very realistic. I don't know if you had a chance to watch it.
I have not, but I've heard incredible things about it.
Yeah, it really gets people to understand the matrix that we call the ER and sort of how busy it is and just the different things that we see and do, and then the stresses around it. It's really quite remarkable how they did that show.
Oh, that's great. And you and I are colleagues in many ways, but in one way also we trained around the same time. And I bring it up because when I was in medical school, ER was a huge show.
Yeah, no, absolutely. Big influence on me.
Yeah. A lot of people I know who went into ER said that show influenced them.
Absolutely.
So it's great. And I'm happy that doctors like yourself are getting this attention because the work you do is incredible.
Thank you.
I have tremendous respect for anyone in emergency medicine.
Thank you.
And these shows only show a very, very tiny sliver of like how challenging and difficult it is and how incredibly skilled you have to be and how much work and preparation it takes. And it's not easy.
No, it's not easy, but at the same time, it's incredibly rewarding.
Yeah.
To make an immediate impact on somebody's life.
Yeah.
And that's not always, we're not always around saving lives. A lot of it's coughs and colds and bumps and bruises. But it's that one case. And for me, for me to have a positive shift, I want to find one patient that I connect with a shift at a minimum where because I grew up near my hospital and I want to have a connection with that patient, and typically the elderly patients that are my parents' age, and it makes me feel good for providing that care to them, and that's why we do this. You make people's lives better by improving their self-image, and I try to piece people back together.
Yeah. I think if you were to ask any medical student why they go to medical school, I think the common core reason we all do it is because at the end of the day we want to help people, whatever form that is.
Right.
Like you said, in my case, we're helping people in the sense that we're taking someone that's maybe, in the case of reconstructive surgery, someone who's been injured or damaged by some accident or trauma, and we're making them better. Or we're taking someone that's already normal and we're making that feature that bothers them better.
Right.
And in your case, you're literally, saving lives.
Yeah. There's certainly those days where you certainly have that immediate and sudden impact on patients' lives, and then there's those days that you're really just, seeing a lot of worried well. They have a cough and they're concerned.
Well, the reason that I'm so excited to have you here is because, as I just said, at the core, what we want to do is help people. And on the surface, you would think like, what the heck can a plastic surgeon and an ER doctor have in common? Well, that's one thing. The other thing is we truly care for our patients. At least, good plastic surgeons who love our field, we truly are passionate about what we do and care for patients, just like you do when you care for your patients.
Of course.
And unfortunately, there are many situations where you'll see patients who have had difficulties or complications from plastic surgery. And I think it's an important topic to discuss, especially for anyone interested in plastic surgery. I think there's a lot of valuable information they can get from listening to this.
No, absolutely. And it's interesting, we know a lot of physicians in the community, throughout the community, but what you don't want to be is a patient where the ER knows that doctor per se, unless they work and taking call, because that means, again, this is the first time I've met you, but I work at a very big hospital. I've never taken care of your patients
And
before.
in this case, it's a good thing you don't know me.
Absolutely. No, in that sense, because obviously if I knew you, it means I've reached out to you because of one of your patients. And we talked a little bit before the show, and I was sort of interviewing you about your practice and how you really, you focus on being there for your patients. When I ask you who takes call, you kind of laugh and you say, well, I take call for my patients. And that's really remarkable, because a lot of doctors, and I don't want to jump the gun here, but a lot of doctors will sort of pass that off as sort of a burden. And, I'm off, I'll have my colleague, but for you to be able to manage that, that's incredibly important.
Yeah.
So,
well, I appreciate that.
Yeah, I've not had the opportunity to take care of your patients, which is fantastic.
I'll take that as a compliment.
Absolutely.
But before we get into it, I think it's always very valuable for people to understand like what your background is. You have a very impressive resume. I think it's worth going through it. So why don't you share with us where you went to medical school and then you did your training in emergency medicine?
Sure. Well, I'll actually go a little bit further back. I'm an LA native. I grew up in LA. I went to Harvard Westlake. Back in the day, it was called Harvard. It was all boys, and then it merged to Harvard Westlake later on. Went to UCSD for undergrad, and then I spent a year after college getting a master's in applied physiology. And then after that, 4 years of medical school. And, back then, emergency medicine was Chicago Medical School.
Chicago. Yeah. Great school.
And back then, emergency medicine was incredibly popular and incredibly competitive. There's those top specialties: dermatology, plastic surgery, neurosurgery. And then, we all competed for the 9-10 slot, whether it's emergency medicine, whether it's nephrology or whatever. And it was incredibly competitive. And so I really, really, really wanted to get back to LA to my family. And so, I worked very hard at my medical school and was fortunate enough to get back into UCLA for it's called a 1+3. So I did a year of internal medicine and 3 years of emergency medicine.
Which for our listeners, it's a superior, incredible program, very prestigious.
It was very, very balanced in terms of its research and exposure. And then at UCLA, my final year was a chief year. So, I spent a lot of time teaching. And then after that, I worked at a place called Antelope Valley Hospital, which is a big knife and gun club where I sort of really tested myself after residency, where, I see stab wounds, people getting scalped, shot, every which way. And so I did that for a couple of years as a night doc. And then I went pretty much full-time academics as an assistant clinical professor at UCLA for about 15 years. And then I moved into community practice on top of that when I had a couple kids, and now I'm working at Providence Cedars-Sinai, which is a very large community hospital.
Absolutely. And what's your position there currently?
So I was actually the director there for about 12 years, and now I stepped down as director to spend some more time with my kids. And I'm the chief risk officer, so I deal with a lot of medical malpractice. I'm the chief risk officer for a national company, so thousands of doctors and providers. I manage their lawsuits, and I put all that stuff together. I do compliance and all that kind of stuff, and then I'm a full-time ER doc, which I really enjoy. So full-time emergency medicine is about 14 to 16 8-hour shifts a month. Anything more than that, you're going to burn out. So that's what I'm doing right now.
Yeah. So to say that you have had plenty of experiences is an understatement, because with that impressive resume, your positions, you've seen it all, I'm sure.
I have. And actually, I don't know, I can't recall how your and my relationship began, but when I learned about you, I was actually, in this podcast, I was actually excited because I think it is incredibly important for the public to know what I know and what you know, but what I firsthand experience and some of the things that I've seen that people just don't know. It doesn't make the news. And no way you would ever know about it.
That's right.
And so actually, during COVID, I was on the news quite a bit talking about COVID, and they would interview about how the reality was, and I'll just put this out there. I stopped doing the news things when I started being encouraged to say things that were, although they were factually true, they were misrepresentative. For example, when after Delta came around and Delta was incredibly dangerous and people were dying, well, they had Omicron, and the news wanted me to say how contagious it was, which wasn't factually incorrect. But I wanted to reassure people that, all right, it's contagious, but nobody's dying anymore. Get back to your life. And the producer said, no. So I stopped doing that when I realized that I'm, sort of a spin. And so I wouldn't come onto a podcast, including yours, without being real with myself. I'm too old to try to, make people feel good. No, I'm here to warn people of the things that I've seen and the things that, that you know about.
Yeah. Well, as you said, before we filmed, we were kind of sharing some of our experiences and our opinions of the current climate of medicine and what we're seeing in the world of plastic surgery. And Your point about media is very, very good. It's a very good point because we're seeing it in a lot of different aspects, including in the promotion of plastic surgery. Because to your point, a lot of it is spinning things in a way that's serves the person putting it out, whether it's a TV show
Right.
or a magazine or a plastic surgeon or a so-called plastic surgeon promoting their services. I think today my hope is that we can shed a little bit of light of like what goes on behind the scenes, and maybe help some patients out there maneuver this very murky waters of like trying to find like who a legitimate doctor is.
No, absolutely. I mean, in here in LA, you'll get the whole gamut
That's
of
right.
capabilities and people calling themselves this and calling themselves that. And how do you pick?
That's right.
You know?
Yeah, because there are a lot of great surgeons here, a lot of
Yeah.
great doctors, but there's also a lot of bad apples, as they say.
And absolutely.
So when would you say was the first couple of times or cases that you saw that really made an impact on you and you were like, wow, what's going on here that concerned you?
Well, the low hanging fruit, that I was first exposed to working at at UCLA, we trained at half county, half at UCLA Westwood. Well, in the county hospital, which is, pretty far north in the valley, we would have patients actually just, again, this is the very easiest to discuss because they would actually come from Mexico. So we'd have patients that would go to Mexico because it's pennies on the dollar. And they found out they get what they pay for. When there's a complication, they can't go back to Mexico.
That's
and
right.
then they come to a hospital like a county hospital where, you're getting a surgeon that you don't know to manage somebody else's post-operative complication. And as a surgeon, I'm not going to speak for surgeons, but surgeons don't really like doing that. And they don't want to deal with somebody else's complications. And they will, because especially the ones that they call, they're amazing. And they do that. But they don't know what the surgery was. They don't know what the patient, they don't, and it's just a downward spiral. And so that was the first sort of introduction where we would literally see these patients. I had surgery in Guadalajara, and your first instinct, well, what did your doctor say? What doctor? They're gone,
That's right.
And you see a lot of this medical tourism stuff where people go
Right.
to other countries and stuff. And yes, you save money, but you end up getting what you pay for.
Yeah.
And then so as I
And
transition,
sometimes you end up spending more money
oh, absolutely,
to fix the problems. That's right.
if you can fix them.
That's right.
Right.
That's right.
And so then I moved to more of a community practice, and I started seeing more, private plastic surgeons, and I didn't realize there, that there were actually a wide spectrum of private plastic surgeons that went to good residencies, but, perhaps they're skilled or not skilled, but they don't really, their heart's not in anymore. Let's put it that way.
Before we get into that, which I definitely want to cover, I think it'd be worth spending a little more time on this issue of medical tourism.
Sure.
Because I don't know if you're aware of this, but we hear this all the time. A lot of patients do fly out of the country to get surgery. Mexico, again, is very easy because it's right next door. But a lot of patients go to Turkey.
Yeah,
That's a big destination for surgery. Or the Caribbean or South America. And I have a little bit of experience with this because I'm Latino. And I happen to have colleagues in these countries. And what I often tell patients, because I'll have patients I'm doing consultation on, and I often ask patients, so if you've had other consultations, let me know. I'm happy to elaborate or clarify. And they'll say, oh yeah, I'm considering this doctor in pick your country, Mexico, South America. And what I share with them is, there are excellent surgeons in other countries.
Of course.
You can find great surgeons in Mexico or South America, the Caribbean, wherever, Turkey. And a lot of them do excellent work. Okay, but what they're not thinking about is what you kind of alluded to, is what happens if you have a complication. Now, let's say you have the complication in that country. Well, now you're stuck.
Yeah.
Because a lot of times you can't fly out of the country. So now you're in a foreign country, maybe in a country where you don't speak the language, and you're having a medical complication. What if it's life-threatening?
Right.
I mean, that's a nightmare.
I couldn't even imagine.
I couldn't imagine. Then think about cost. So you said, okay, you're saving on the upfront price, but what if now you have to extend your extend your hotel, you're buying food, maybe there's nurses you have to pay to care for because you don't have your family or friends around. I mean, there are all these things that a lot of people don't consider. The other thing that I add is, and I've seen this firsthand because I have done trips overseas where I've examined other offices and things like that, where I visited other surgeons. And sometimes it's not the surgeon, but it's the facility.
Of course.
So I gave you a tour of my office today. You saw my operating room.
Of course.
And I was proudly sharing with you how we're quadruple A certified. There's these
Yeah.
certifications we have and these guidelines we follow. It's very strict in the United States, very strict. If you have an operating room, we are constantly being inspected, and we have surprise inspections, and we have to have logs. And they don't have any of that in some of these countries.
That's how they keep the costs down too.
Exactly. So imagine you're at a facility. Maybe your surgeon's great. Maybe you love his results on social media. But what if they're not sterilizing the equipment properly? What if they're not maintaining their instruments the proper way? You can have a terrible infection from the equipment, and no fault of, I mean, theoretically not the fault of the surgeon, but it's the fault of the facility. Right. So these are all these things people don't think about.
No, absolutely. And I think a good way for people to understand this concept is, the surgeon, or in my case as an ER doc, when a code happens, I'm the captain of the ship. I'm responsible. Yeah. As the plastic surgeon for your patient, you're responsible for everything, every aspect, whether it's the nurses, the staff up front, the anesthesiologist that you pick, you manage all of that. Now, if you juxtapose that with a captain of a ship, you can have an amazing captain on a really little bad boat, right? A really little, like, old broken down boat and vessel. Well, the captain's only so good. And I think that's what you're referring to. If you go to another country, you can have an amazing surgeon, great captain, but the boat's no good. Now, the flip is also true. You can have a bad captain in a beautiful boat, which we also see. And so you get in the boat and you're like, this is great.
Yeah.
But then you go straight into a storm and you capsize.
Yeah.
So what people really want, obviously, when you're looking at changing anything about you, whether it's your gallbladder or anything, or reconstructive surgery, is where's the nice looking boat that makes me feel safe and comfortable with a skilled, knowledgeable captain.
That's a great analogy. Because another thing I often hear patients will say, because I do a lot of revisions. So I have patients who have had surgery elsewhere and they're coming to me to fix it. And I want to mention something else after that. But I've had these patients say to me, I can't believe that I've had such a bad outcome. I went to the doctor's office. It was so nice. Right. And it was so fancy. And it was just so beautifully decorated. And I can tell that that's why they made their decision. Because I'll ask questions like, well, this doctor you went to, I'll later discover the doctor wasn't board certified or not even a plastic surgeon. And I'll be like, what made you choose the doctor? Like, how much time did the doctor spend with you? And they'll reveal and kind of admit to me, like, yeah, I kind of had a funny feeling about him. But the office was so nice, I figured he had to be good. So that's a very good point. Sometimes you can have the best captain in a terrible ship, or the best ship with a bad captain. Yeah. The other thing I wanted to say is what you said earlier about surgeons not wanting to take care of other surgeons' complications. It's exactly what you explained. We care for our patients. Like I have patients sometimes who come to me with complications from other surgeons, and I want to help them. The problem is I don't know what was done. You can't get a clear medical record on them. You can't get a clear operative report. And then now, now you've taken something and made it so complicated that it's a very difficult position to be in as a surgeon. And most surgeons are very reluctant to take that on because we want to do things to make people better, and we're not sure sometimes if we don't know what's been done and what materials the person has in and what sutures they use. I mean, all these details that are important for us.
Yeah, no, absolutely. And that took a while for me to learn the thought process for a surgeon, because we used to call, as an intern and second year resident, we would call the surgeon and, from these patients that came in from Mexico, and it'd be so much more complicated than we could ever imagine. Why not just open them up and look? Right. No, a surgeon, their job is not just to cut, it's to evaluate and fix the problem, whether it's with medicine, whether it's just with a handshake, and I'm sure you see clients or patients all the time where you don't feel that they would benefit from surgery, and that's another measure of a good surgeon is the ones that don't cut. Yeah. Right? Yeah. They cut when it's appropriate, that'll benefit the patient, not that they'll benefit their wallet. Right. Right? And that's
I'll often say it's equally important to know when to operate and when not to operate. Yeah. Because as a surgeon, what one of the things we're taught is you always have to be prepared for every scenario. So when we go into a surgery, we're always thinking of like, well, if A doesn't work, I want to be ready with
Right.
B, and if B doesn't work, I have C. You have backup plans. You
Yeah.
have different scenarios you run through your mind. So now you take a patient who's had a complication from a foreign country. You can't get an operative report. You have no idea what. Now you don't know what the backup plans can be. You don't know what scenarios you're going to face. It's a very, very uncomfortable position for a surgeon to be in, and we hate
absolutely.
that. We hate being in that position.
I respect that, but it took many years for me as an ER doctor to understand it, and I absolutely understand it.
So then you were mentioning now, not only surgeons or patients from other countries who come in, but how about patients who have been operated in the community? That's also sometimes an issue.
Yeah, I mean, the number of stories that I have from botched plastic surgery, and again, the botched plastic surgery that comes to the ER is not the one with the little droop from Botox, right? Those go to the office or something else. I see the bad of the bad that have to come to the emergency room.
Right.
I get patients that are sent directly from an outpatient surgery center where, the patient stopped breathing, where they had a complication, where they transfer the care to me. And think about, and I gave you a situation, I'm going to change the details of it so that there's no patient identifiers, but for example, I had a 40-year-old male that underwent a sort of a large volume liposuction, which I know that you and I had spoken about earlier.
That's right.
But this man had a kidney transplant and all this kind of stuff. And he didn't just have the liposuction; he had a facelift, he had neck stuff, and all this kind of. And what had happened was, after the surgery, he wasn't being monitored, and so by the time he arrested because his ventilation dropped.
And by the way, for the audience who's listening,
Yeah.
That means that their heart stopped functioning. Yeah.
Yeah, he wasn't being watched. And this is a guy that had a kidney transplant, very high risk. But anyways, so I get a call from the paramedics saying we're bringing in a patient 5 minutes out from a surgery center that just had plastic surgery. That's all I got. Comes in and the guy's totally swollen. There is no airway. His neck is all bruised from the lipo and it's just a nightmare. And the sad thing was, well, yes, I had to take out the stitches to relieve the pressure, and then I ended up having to do a cricothyrotomy because there's just not everything was so swollen and edematous. And this patient ended up being an organ donor for what was left. And this is just one of many. I can spend hours, sadly, talking about these cases where there's either neglect or it's the wrong patient chosen or the wrong procedure chosen, it's really too bad. Again, I appreciated what you had mentioned earlier and I asked you about your liposuction, and you said, well, I only do it on certain people. And that made me think, well, I would imagine the bigger the person, the more you could get out and the more you can bill. Again, this is sort of what a lot of people, I think, think. But no, you said, I don't want to do it to somebody I might harm, which is impressive. It's not about, necessarily making somebody look good. There's no point in that if they're not going to survive or they're going to have a bad outcome. Right? You got to find the right patient and the right procedure.
And the thing is that they're like, when you're a board certified plastic surgeon like myself, who is a member of all the societies and committees, and there are guidelines for this stuff.
Of course.
So there's what's considered, large volume liposuction that we are told and we know is risky if you exceed a certain amount. So very good, reputable plastic surgeons, we don't exceed that. We just don't, because we know the risks are not worth it and it's dangerous to the patient. But there are a lot of surgeons out there who, don't follow these guidelines. No. And the problem is that sometimes patients, they have no idea. Like they meet with a doctor and maybe they hear all this great things like, oh, I'm going to do this and that. And they're not understanding that maybe that doctor is not really having their best interests at heart.
Right.
Yeah.
Right. No, absolutely. And, if, for example, you turn down a patient for a procedure, they can go to another surgeon that will do it.
Yeah.
But if there's one surgeon that says no, that's the one you got to trust. It's the ones that say no. It makes those are the ones that are trying to put you in front of the bottom line.
What's funny is, again, since I see a lot of revisions, the number of patients who have told me after the fact, after they are coming to me for a revision, and they'll say to me, I had a bad feeling. They kind of knew. Yeah. Because
of course.
Like anything, when you're going, like you go to buy a car and the car salesman is being a little too slick, you kind of know this guy's being a little bit shady here. Yeah. You know in your gut when someone's being honest and being transparent. And it's the same with doctors. Like
absolutely.
With plastic surgeons, when you go to plastic surgeon and if they're giving you solid information saying, maybe this is a little bit too much to do in one setting, maybe we should separate it, maybe we do one thing first and then you understand in your gut, like, okay, this doctor is actually caring about my well-being. Whereas if a lot of patients tell me they go to a doctor and they're like, perfect, absolutely, you want that, no problem.
Right.
Oh, it's going to look amazing.
Right.
It's going to be no issues. But
Right.
and it's like, if it's like the saying goes, if it's too good to be true,
It
it
is.
probably is. Yeah.
No, it is.
Were there any common denominators, commonalities when you would see these complications, like characteristics of like the kinds of surgeons that they were going to?
Well, yeah, you know, I hate to say it, but it's the low costs. You know, people that market themselves as a low cost surgeon, you know, it's like if you're going to the moon in a space shuttle, you don't want the lowest cost, you know, mechanic fixing your space shuttle. You want the most qualified.
Yeah.
And that's what it boils down to. We have what's called, you know, it's a degrading term, but we use it as doc in a box. And we say that for ER docs and urgent cares and you know, even plastic surgeons. But it's essentially a doctor that sets up practice that really isn't what they say they or claim to be. Now, and you know this, so I'm preaching to the choir, but a doctor, when they get their license, you become a physician and a surgeon, right? I'm not technically a surgeon, but I do little minor procedures, but my card says physician and surgeon, and I can do whatever I want. There's nothing saying I can't do breast augmentation. There's nothing saying I can't do facelifts. I can go learn it and do it.
That's right.
And I can set up shop and say, I do plastic surgery, and that is a fact, and that's reality. However, when push comes to shove, it is illegal for me to identify as a board-certified plastic surgeon. Now, anybody in the medical field knows that if you're going to have surgery, you're going to go to the surgeon that trained in that type of surgery. I'm not going to go to a podiatrist who specializes in ankles to have my gallbladder removed.
Right.
Nobody does that. I'm not going to go to an orthopedist to have my brain operated on. So I'm not going to go to a dermatologist to get a facelift. I'm not going to go to a OBGYN to get a breast augmentation. Doesn't mean they're not qualified to do it. It just means that I know if I'm going to go to a plastic surgeon, they are qualified to do it almost across the board. I know that their training is, they've done it. And again, that doesn't mean all plastic surgeons are, you know, good in what they do, but it means at least I'm starting at the right on the right path.
Yeah, that's a good point.
And that's actually pretty scary. That's another thing that I've noticed is that, you know, some of the complications I've seen is when I hear, oh, a plastic surgeon did this liposuction, and I had a patient die from a fat embolism, and that's when you do liposuction or whatever procedure, and a little fat enters the vein, and it comes back and goes in your heart and lungs, and it sort of gets you to stop circulating, so you die. And I found out that the doctor that had done it was a family practice doctor. You know, and respectfully, family practice is amazing for what they do, but they don't do surgery.
That's right.
But they can learn it. They can go to a weekend Vegas course, learn it, and get quote unquote certified.
By the way, you probably are not aware of this, but right now you're probably blowing people's minds, because whenever I share this information, people are shocked because they believe that if someone says that they are a cosmetic surgeon or a plastic, they must assume that they are. But as you just explained, it's not sometimes.
No.
See, we never imagined, we were talking about this earlier, when we were in medical school, and even, you know, before that, we never imagined that people outside of their specialty would be trying to do another specialty, right? Because, like you said, you know, no one who's a podiatrist would never think of trying to take out a gallbladder. It just is absurd. But a lot of doctors recently, in the last couple of years, have been trying to do cosmetic surgery.
Of course.
And you mentioned a family practice doctor, okay? So here's another problem patients have. Like approximately 20 years ago, the American Board of Plastic Surgery made a marketing effort to educate people to look for a board certified plastic surgeon and to make sure they asked if they were board certified. And that was a great marketing effort. It worked. And a lot of people learned to ask about that. But some of these doctors got around it because they are board certified.
Right.
They're just not explaining that it's in family medicine or in, you know, OBGYN, like you said.
Right.
So there was a case not long ago. It was in the news. And it was a pediatrician.
Oh, wow.
So this is a doctor who specializes in children.
Yeah.
Apparently was advertising liposuction to the mothers of his patients.
Oh, wow.
So here you have a mom, you know, she's coming in, and while he's taking care of the kid, he's like, hey, have you ever thought about having liposuction? I mean, it's kind of like, in a way, it's like brilliant marketing, because you have these moms who probably, but you know, how awful is that? A person that has no surgical training.
Right.
And the reason this was in the news is because a patient of his eventually had a complication and passed away from it. And I think he was being investigated and going to prison. But it sounds crazy,
No,
but this is
absolutely.
what's happening out there.
Absolutely. And again, for full disclosure, I used to own a med spa where we did Botox and Juvederm. However, I didn't do it. And it's not that I couldn't do it. I could go to a course and do it, but I hired, as we spoke about earlier, a plastic surgeon to oversee that part of it because, me first and foremost, I'm not gonna, I have my training and my skills and my background, and I can do what a lot of doctors do with med spas and just learn how to do it. But I'm not ever going to get to the skill level where I'd be comfortable, injecting people with things where you can get, necrosis and just, very bad outcomes. So I paid the extra money to have somebody, a board certified plastic surgeon, oversee that.
Yeah.
Because it's just not right. But even their Botox, as simple as Botox.
It can cause problems.
Yeah. And
if you don't know what you're doing.
I would argue, and I don't know, and somebody's probably going to look this up, but I would argue that most med spas are not plastic surgeons.
Yeah.
And look, do I think dermatologists can do a good job? Sure. And are there dermatologists that are surgeons? Yes, they do a Mohs surgery. But that surgery is very
It's for skin
specific.
cancer.
Correct.
For
It's
skin
very specific in that, yes, they take out large volumes, they can do flaps and all these kind of things. But are they trained in
Breast
facelifts,
augmentation
breast
or
augmentation?
facelift, yeah.
No, but they can call themselves cosmetic surgeons, and they are surgeons in that they're training. And again, I am a surgeon, and my license says physician surgeon.
Right.
But they can advertise a little more aggressively that I did surgery. And,
Yeah.
and no, I don't think most people know this.
I think a really important point here is the idea of like the reason why this is so important is because of these bad things that can happen.
Mm-hmm.
So for us board certified plastic surgeons, we're trained on how to do the procedures,
Mm-hmm.
but we're also trained on how to manage complications.
Mm-hmm.
We learn all the complications that can happen. The reason that's so valuable is because it's like anything else, it's prevention. So when you're
Mm-hmm.
aware of all the things that can go wrong,
Right.
you know how to stop them before they
Yeah.
happen. So that's one of the most valuable things we get in training as a plastic surgeon is we're doing all these surgeries. We know what happens when something starts bleeding. We know what it looks like. We know how to stop it. We know how to reverse it. We know how to handle it. If tissues are not healing well, we know how to handle this thing. And people forget that when things go great.
Right.
Thank God, knock on wood, you're lucky, you made it. But what if something goes wrong? That's where you want to know that the surgeon you went to is going to take good care of you. So it's not only that, let's say, avoiding the complication, which board certified plastic surgeons are very good at, but then it's handling it after, because I think you were sharing with me that you would see sometimes these problems and then you're trying to get in touch with the doctor and they're nowhere to be found.
Nowhere to be found. And, it brings up an interesting point that I just thought of. What a lot of people understand is when you do a plastic surgery residency and or fellowship, you don't just start working on breasts. You don't just start doing facelifts. You take call, and as you did for the ER, for years.
That's right.
And so I
lived in the emergency room.
Yeah. No, and God thank you and bless you for that, because we need plastic surgeons. And we have plastic surgeons that take call for us, and they're amazing. But you guys see the worst of the worst, especially in Montefiore, New York.
Yeah.
You're going to see the worst of the worst. And so what people understand is if I go and do a 3-day course on Botox or a 1-week course on breast augmentation and start doing that, I'm only going to see the good outcomes. I'm not going to see the gross and grotesque stuff where I have to piece stuff back together. And those are the skills that, as you mentioned, preventative, where, look, there's a little bleeding vessel. If you don't cauterize that, you're going to get a hematoma, which can get infected, whatever. Knowing how bad it can become is so important because it makes you scared. Am I wrong? Makes you nervous in surgery to look for all those things because you know how bad it can become.
Right.
But if I just go to a course and learn how to do breast augmentation on healthy women and I see good outcomes, I'm not going to be scared. It's easy. I mean, again, it's not easy, but mentally it's easy because I'm not concerned.
Right.
I don't see the breast that gets necrotic and then gets chopped off and can't heal and goes, your chest, your bones are exposed, the kind of things that you've seen and that I've seen. We see that kind of stuff, what the human body is capable of when it's not treated properly.
Right.
And, and it's that training that you will not get. Again, I have full respect for every specialty and what they do. But again, dermatologists see some bad skin stuff, but they're not going to see the bad outcomes from surgery or the the trauma patients that you've dealt with that you have to, where does this go? You know,
and
that's so important.
So another question I wanted to ask you, this is a tough question because on the one hand, I don't want to scare patients. But on the other hand, I do think it's important for people to understand, because one of the comments I get sometimes from patients are like, oh, I mean, it's just cosmetic surgery.
Right.
Like, how bad can it be? But if you don't know what you're doing, you can really, really create a really bad damage or really injure someone. What would you say is one of the most heartbreaking cases you've seen that really just rocked you to your core?
You know, sadly, there's a lot, but specifically relating to plastic surgery. I'm going to change the details a little bit for patient privacy, but so I had a 30-year-old come in, say it's a male, that had liposuction, didn't need it. Respectfully, I saw pictures before, and it was done by his friend that was not a plastic surgeon that did this in the clinic.
Not a plastic surgeon.
No. And, you know, again, it's routine lipo. You know, how hard can it be? I just stick a cannula in and suck some stuff out. But no, there was a complication, and this guy unfortunately died and left his whole family. The whole family came in. It was, you know, again, when you go to a quote unquote routine procedure, which, as you know, is nothing's routine, right? As soon as you approach a procedure and make it routine, then all bets are off. You get lazy. You get complacent, and you know, and so in this case, it was advertised to him that, yeah, we'll do it. It's Father's Day. We'll do it. And it was for a Father's Day gift. And, you know, he turned 40 or 30, I forget the age, but, and he's dead as a result of that. It was an inexpensive procedure, but he's dead. And arguably he didn't need it beforehand, but that's a judgment call. But, you know, had he not done it, he would still be there for his kids to walk him down the aisle and et cetera. And perhaps if he really wanted to do it and he sought out the options, you know, and without going with, hey, this is free, let's go there, you know, and actually did his homework and found the surgeon that has done these before and is trained in the worst case scenarios so that you can prevent those.
Well, I'm you know, that's a heartbreaking story, heartbreaking case. But in a way, it's very illustrative of the things that I've tried to educate patients about, because liposuction, most patients think that is so simple.
Right.
And that is, you know, one of the procedures that a lot of doctors who are not plastic surgeons try to do, because you can literally take a weekend course and then think you're going to do it fine because it doesn't look hard. But there are so many things that can go wrong if you don't know what you're doing, especially, believe it or not, in someone who's thin. And the reason has to do with the fact that the cannulas that we're using, they're blunt, but they're still pretty long. They're made of metal. And if excessive force is applied, you can go through tissues.
Sure.
And if you angle something at the wrong angle, if you don't know the anatomy, you can puncture through the abdominal wall. And so there are cases of many patients who have gone to someone who's not a good practitioner, not a board certified plastic surgeon, where they're doing liposuction and the cannula goes through the abdomen and punctures an organ. And so, you know, this shocks people, but this is what happens. And it's now, look, the truth of the matter is it can happen no matter what. It can happen to a plastic surgeon as well. But it's just much less likely that you're going to have a bad outcome if you go to someone who's a reputable board-certified plastic surgeon, because we know the anatomy. We've done it so many times. We know exactly where the layers are, the tissues. We know the angles. Like when I do surgery, patients sometimes ask me, how do you know how to put things together? And I explain that, you know, after 20 years, and even when I was training, you're seeing these things throughout the entire surface. So I'm seeing the external surface, but the internal surface. And I trained in general surgery as well, so I know the anatomy. And so three-dimensionally, I without even needing to see it with my eyes, I can feel it, and I know where things are, and I know where the rib cage is, and I know where so that's something you can't learn in a weekend. That's not anything you can learn in a video, which some doctors do. They watch a video and they're like, oh, I think I can do this procedure now. No. It's insane.
But I think one of the other things that you're capable of that a lot of people that take these weekend courses are not capable of is if there's a complication, which, like you said, it can happen. It can happen to the best surgeons in the world because everybody's different. but when there's a complication, can you manage it?
That's right.
Right? If I'm a family practice doctor and I lacerate the liver or the spleen or something, which happens, right? Or the peritoneum, what then? Do they ignore it and leave it open? Like, what do you do with that?
Yeah.
And as you said, you did general surgery. So on top of that, with plastics, so you're going to know, you would be the one to fix it anyways.
Yeah.
So, it's a sort of a one-stop shop. You've got
Yeah.
your bases covered from start to finish.
Right.
Um,
Well, there's a case recently. I think I mentioned it to you, and I don't know the details. I'm not familiar with the care that happened, but allegedly this is what happened. Is there's a dermatologist in this community of Beverly Hills who was advertising as a cosmetic surgeon, and in fact, patients were confusing him for a plastic surgeon, and he was a dermatologist who was now performing facelifts on patients.
wow.
And the patients that he was doing facelifts on believed he was a plastic surgeon. So, going back to this idea of misleading the public. So he was doing facelifts and apparently wanted to pass his practice on to a relative and train his relative, who was also a dermatologist, to do facelifts, and then asked that relative to do it on him. So these are two people that are not trained in surgery, are not trained in plastic surgery, doing a very complicated facelift procedure.
I'm going to guess the outcome was really good.
I don't know what's more heartbreaking, the story you told me or the one I'm about to tell you, because the relative operated on him doing a facelift, so a procedure that they're not familiar with and don't understand. He ended up developing a very severe complication and then passed away from it. And again, this is all alleged. I don't know the details, and I'm not going to pretend to know exact details of what happened, but apparently when he developed a complication, the relative was unable to manage it, did not know how to manage it. The care was delayed, and by the time he was able to get to the emergency room, he either passed away or passed away very shortly after. So it's you hear these stories and they're heartbreaking because they're not necessary. They're needless. This stuff shouldn't happen.
No, absolutely. And let me ask you, because even as a physician of 20 years, who can call themselves a cosmetic surgeon? Because you hear that term passed around, plastic surgeon, cosmetic surgeon.
Right.
And there's courses online that you could take to become a cosmetic.
That's right.
What does that mean, a cosmetic surgeon?
Yeah, it means nothing. So this is a great question. And, the problem is, the challenge is, once I explain this, you're going to instantly understand what I'm going to say because you lived what I'm going to tell you. But for the common, for the average person who's not in medicine, the lay person who's not in the medical field, it is incredibly complicated.
Of course.
Because it has to do with board certifications and the approved specialties within the American Board of Medical Specialties. So the long answer to this, and then I'll give the short answer, but the long answer is that, as you know, in medical school, we're all trained. We all receive an MD degree, medical doctor degree. So we're doctor of medicine. And at that point, we're all basically equal. We all have the same education and training and everything. But while we're in medical school, we're trying to choose what our path is going to be.
Right.
In your case, you chose a specialty of emergency medicine.
Right.
Other people choose a specialty of family medicine. I chose a field of plastic surgery. But these are recognized fields by this association called the American Board of Medical Specialties. And they're the ones that, over historical time, since the formation of these specialties, decided, okay, this is what this specialty is called, and these are the requirements to become this specialist, and they kind of regulate that. And there's only, not that many recognized specialties, right? And we know them because our friends are in them, right? So plastic surgery is a recognized specialty, just plastic surgery.
Right.
Not anything else before it or after it. Board certified, plastic surgery is a recognized specialty that you have to undergo specialized training for.
Yeah.
If someone calls themselves a cosmetic surgeon, that means nothing because that's not a recognized specialty.
Of course.
It's not recognized. There are no guidelines for it. There are no formal definitions of it.
But there's societies for it.
That were created by the doctors who wanted to call it that. So there's it's funny. I remember I received something in the mail a couple of years ago, and I was so tempted to post it on social media, but I tried to be the bigger man and I didn't do it. But it was basically an application for the American Society of Cosmetic Surgery, whatever it was. And do you know what the requirements were to become a member? Write a check.
Really?
Yeah, that's it.
Wow.
There was no.
You could have added that to your wall.
I could have. I could have been another certificate on
Right.
my wall. But there was no. There was no There was nothing to verify my training.
No.
Nothing. It was basically something mailed out to every medical doctor they probably could find on a database, and all you had to do was write a check and it was like, I don't know, $100.
Yeah.
And that would become a cosmetic surgeon.
You're giving me some ideas.
Yeah, I was looking out
Right.
for you. Yeah, so that's the sad thing is that anyone can call themselves a cosmetic surgeon. It means nothing, and unfortunately, a lot of other surgeons, will use the term plastic surgeon, but they're not really a plastic surgeon. Like the case of this, dermatologist who became known as a plastic surgeon. People called him a plastic surgeon. In fact, when he passed away, it was in the news, and he was listed as a plastic surgeon by the magazines. So, that's why patients are confused sometimes. They'll tell me, I'll do consultations for revisions where I'm fixing, someone that wants me to fix a problem. And I'll say, who was the doctor you saw? And they'll tell me the name, and I don't recognize the name. And that's surprising to me because I know all the plastic surgeons in this area. I was the president of the Los Angeles Society of Plastic Surgeons, so I know everyone here. Yeah. So when I hear a name I don't recognize, it's like a red flag. Yeah. And so I looked up the doctor and I said, this doctor's not a plastic surgeon.
Right.
And they fought me on it. They're like, no. He said he's a plastic surgeon. He called himself a plastic surgeon. I'm like, he can call himself everything he wants, but he's not.
Right.
And so this is why it's so confusing to patients.
No, and it's interesting, even in my specialty, my specialty is relatively new, I believe, compared to plastic surgery. Back in the 70s where it started, where anybody, I'm sure you worked in the ER, and everybody, a psychiatrist, anybody would work in the ER. Nowadays, you have to be board certified in emergency medicine, but there are still some ERs, some small ERs where you'll go in, you'll find a family practice doc, or you'll find an internist or radiologist that's sort of covering, and while they don't advertise because you show up at the ER, you get what you get, it's dangerous, and there's people that, again, it's different, but the same. They call them an ER doc because they work in the ER, but they're never trained in what we do. They're not trained in the critical procedures, the critical thinking, and it's scary. And the same thing goes for PAs and nurse practitioners, right? A lot of patients see a nurse practitioners, don't know they're nurse practitioners, right?
And they'll call themselves doctors.
Correct.
Yeah.
Well, they'll call themselves doctors or just let the patient assume.
That's right.
And it's again, the misinformation that's out there, or the misdirection that's even, performed by some of these providers is scary.
Yeah.
And that's why it's so important to do your research. And let me just say, how do you do your research? For me personally, if I'm going to go, as a doctor, I know the good doctors. And I think that's one of the best ways to find out. You ask their colleagues, so how is Dr. Diaz? You know Dr. Diaz? And I asked about you before, and I asked some plastic surgeons. I actually played poker with a plastic surgeon on Friday. Okay. And yes, he knew of you. He's like, oh yeah, and in a good way, obviously.
Okay, good. I was going to say, I hope
we
you
can
said
edit
good
that.
thing.
No, and that's how that's how you would go to find an orthopedist.
Right.
You don't just look at what's popular on the billboards,
right?
Because we know anybody can do that.
Yeah.
You go and ask the people that know, which are the physicians, right?
Yeah. Well, we were talking about this earlier, how the world of medicine has changed, especially for plastic surgery, because when I started out almost 25 years ago, doctors didn't even have websites.
Yeah.
Like if a doctor had a website, that was like, oh my God,
Right.
like he was an outlier. And the most that I knew of any doctors who advertised, it was like maybe in the yellow pages. There's probably a lot of young people who are listening to this who have no idea what the yellow pages are. So that's how little marketing there was. Now there was still marketing, there was, magazines and things like that. But for the most part, a plastic surgeon made their career by taking good care of patients.
Right.
Because what would happen is, and this is what all of my mentors said, they would say, John, you take good care of patients, you get good results, and everything will come. Success will come to you. Just do good work. And that was true, because you would operate, let's say you operate on, someone who's a wife of a friend, and then that person sends their mother, and the mother sends their sister, and then they send their neighbor, and over years and years and years, your practice grew, and it was word of mouth, and because you built the trust and the respect and the reputation. But nowadays, anyone can make themselves look like they're a good doctor or a good plastic surgeon, and unfortunately, it's social media is very powerful. It has its incredible advantages. Like information is so readily available to everyone now, and back then maybe it wasn't. but it's almost, it has its disadvantages in that unless unless you have the knowledge of like how medical specialties work and things like that, it's very easy to see a doctor on TikTok and think like, oh, he seems like he's really good. Yeah. He dances well. He must be a good surgeon. Right. I mean, literally, that's what it's come to.
Yeah, no, absolutely. It's unfortunate. It's not how people should get information. But I also think that people that get cosmetic surgery or reconstructive surgery, I don't think there's anything to be ashamed of personally. I think people should be proud of the decisions they make. And people shouldn't shun people for decisions to make. Your body, your choice. And I'm not making a political statement. I'm saying that if you think you'd feel better with larger breasts or thinner or better jawline, so what? That's your life. That's your money. You do what you want to do. There's no reason to pass judgment. I don't care what somebody else does. If they're happy, fantastic. If they're happy, it's going to make me happier because they're happy. And I want to be around happy people. And so, with people that get cosmetic surgery, I think they should talk about it. I don't think there's anything to be ashamed of personally. And I try to teach my kids that same thing. If you're going to do something, it shouldn't matter what other people say, right? A lot of people think, oh, I don't want to tell people and it's nobody's business. You don't have to talk about it, but should never be a point of contention where you're ashamed or you're embarrassed. So what if you were born with something you don't like? You have the ability to change it now. And you can do it safely under the right circumstances. And so, and by talking about it, that's how you get back to that word of mouth. Oh, well, I would have never known. You look so fantastic. And that's how, that is what should be promoted. Like you said, not the dancing and the cartoons and all that kind of stuff. I feel like that's belittling medicine. And it's unfortunate.
I agree.
Because are we older doctors?
I think we could say we're
senior
experience. How about experience? Is that a good word?
I never get that. Yeah, experience, fine. but it really has. Medicine has changed so much in the sense with like you said. There's certainly advantages to TikTok, and there's disadvantages. And it's nice to get back to a sort of a community practice of medicine where you take care of the patient like you do, and you care about that patient. Again, I still go back to when I said who covers you. You said I cover myself, and that's great because a lot of surgeons, when we call, is somebody else on call or not available as an answering service, and you can never reach that doctor. And if your patient ever ends up in the ER and I'm trying, I'm busy, I'm going to try for 5-10 minutes. If I can't reach you, I'm finding somebody else.
Yeah. No, it's funny. You were asking me like, well, what do you do if you go away? Or whatever? And, I was sharing with you that like I take all my calls and I call all my patients. Now here's the thing I always tell everyone, like I'm not pretending I'm the only one. There are such excellent surgeons here in LA. Yeah. There are excellent doctors who are the same way, who love what they do. They're passionate. They care. They're proud of the specialty. They want to take excellent care of their patients, and they're the ones that answer their patients. And there's a lot of us.
Yes.
Unfortunately, there's more that are not. And the statistic that I often share is in LA, this was a research I did a couple of months ago, maybe a year ago or so actually. So it might be outdated at this point, it might be worse. But at the time, I looked up these statistics. There are 1,000 doctors advertising cosmetic surgery services. 1,000
cosmetic specifically?
Cosmetic surgery. Yeah, just cosmetic surgery, which is the umbrella term. Let's include all advertisements for plastic, cosmetic, whatever it is. So 1,000 individuals in LA County only advertising. But there's only about 220 of us who are board certified plastic surgeons.
Really?
So the other 800 approximately are not board certified plastic surgeons. So it just goes to show how many people are out there, advertising these services and they're not really qualified to do so. Right. And, again, back to what you were saying about, you go to these doctors, you don't know what you're going to get. Maybe you're lucky. Maybe you get a great captain.
Right.
Maybe you're even luckier. You get a great captain and a great boat. But the chances are very slim because, chances are you're going to get a doctor who's maybe not that experienced. And then worst case scenario, something happens. You're not going to see that doctor. They're not going to take care of you. You're going to end up maybe in the emergency room. Right. And then, I'm sure you've had experiences where, like you said, you're calling the doctor and there's nowhere to be found. They're not answering. Nope. And as a patient, there's no worse feeling than that.
No, you feel abandoned.
Yeah, 100%.
But the other thing that needs to be mentioned and that we spoke about prior to this was that it's not just you. You're responsible for everybody. And so when I talked to you and sort of quizzed you about your anesthesiologist, because the anesthesiologist is the one that is responsible for waking you up and putting you down.
That's right.
And you obviously can deal with everything that can happen anatomically, but the anesthesiologist is there for your life. And so, the doctor that saves a little money, or the patient that saves a little money because maybe the plastic surgeon's doing the anesthesia, or having an anesthesiologist that isn't board certified, or CRNA, right? CRNAs are nurse practitioners for anesthesiology. Some of them are fantastic. Am I going to put my kids in front of one? No. I want the one that went through 4 years of medical school. Does it mean that they're better? No, but I think my chances of having a better doctor or a better provider, as the term is used nowadays, is higher.
Yeah.
And so again, when a patient comes in, what they want to know is, all right, number one, where did you train? What did you train in? What are your outcomes? But who else works with you? Who did you hire? Who's the anesthesiologist? And you were fortunate to have an anesthesiologist that you trust with your patients.
Absolutely.
Because it's their patients, but it's your patient from start to finish for everything. If there's a complication in anesthesiology, guess who gets blamed?
The surgeon.
The surgeon, the captain of the ship. Nobody ever thinks that, but
right,
you
right.
are ultimately responsible.
Yeah, that's right.
And
we take that very seriously.
Absolutely. And that's not a place to cut corners.
Yeah. Yeah. And what you were saying earlier about sometimes people are, they're tempted because it's a lower price. Well, a little other kind of insider scoop information is the fact that some doctors advertise like, oh, I only do it under local.
Yeah.
I do it under local. And what they're doing is they're preying on the fear that patients have for anesthesia.
Yeah.
Because, anesthesia seems scary. We in medicine know it's not scary at all. If anything, it's in many ways it's safer because it's controlled. Right. Okay. But the truth of the matter is a lot of the doctors who don't do procedures under anesthesia, the reason they're doing that is because they don't want to pay an anesthesiologist, or they're not able to have an anesthesiologist because they're not a surgeon.
Right.
And if you're not a surgeon, you really can't have an operating room. So these are things a lot of patients are not aware of. They think that they're actually getting a benefit, but in fact, they're not. So there's so much. There's so much out there.
But also, without an anesthesiologist, correct me if I'm wrong, if you're going to go in and maybe just do a little midazolam and some fentanyl or whatever, if the patient isn't relaxed and they're tense, their blood pressure goes up, bleeding complications,
Exactly.
they tense their muscles, higher chance of perforation.
That's right.
Again, you're going to do it, just do it right. For us, for example, if we're going to go to intubate somebody, you want the first attempt to be the best possible attempt.
Right. That's when someone's having respiratory difficulty and you have to put a breathing tube
Correct.
in. Right. You have seconds.
Yeah. First try has to be the best.
That's right.
And, with surgery, if you're not going to have an anesthesiologist or anesthesia, and, you're fighting it because everybody responds to medications differently, it's going to make it very challenging, which increases your risk for complications. And people don't understand this. They're like, they think that because a doctor does it, it's safe. Mm-hmm. How could they do it? How could the FDA or the regulatory boards allow this quote unquote cosmetic surgeon to do this if it weren't safe? I'm protected.
Right.
No.
Yeah. And it has to do, that's another question I get all the time is like, how is that allowed? Like people that should be illegal. And I've asked this question of like some of the leaders of plastic surgery and there's no good answer. I think what it comes down to is when the specialties were created 100 years ago now. So all of our specialties were created in the 1920s and 30s. And that's when all of this was kind of codified. Mm-hmm. I think what it was is back then, they didn't build any rules that said, if you're a neurosurgeon, you can't do X. And if you're a cardiologist, you can't do Y. Because they never imagined in a million years that if you were an OBGYN, you were going to try to do breast augmentation or do plastic. Like it just never occurred to them to build these rules in because it was absurd.
Right.
Like a lot of things, you can't imagine where something's going to be in 100 years. So now we're in this situation where this is happening. Right. It sounds insane, but there just were no rules put in place because no one ever thought that this could ever happen.
Right. But we're also fortunate to live and work in a very cosmopolitan city where there's 200 and plus board certified plastic surgeons. One of the other reasons I think they're not going to change licensures because if you go into a small town in Wyoming and a family practice doc is there and you need your gallbladder taken out, they are surgeons.
That's right.
They do the job where others can't and won't do it. And they do it, and they save lives.
Yeah.
But when you something that's elective,
right?
You don't need to go to the family practice doc for that kind of stuff.
That's an important distinction.
Yeah, and I think that's one of the reasons the medical board's not going to change it because then you take away all that critical care access in small towns where family practice docs do surgeries and do C-sections and stuff.
Yeah.
And it's critically important.
Yeah. I want to start kind of leaving this with a great message for patients, something that they can take away with and serve them in their research, because you've been in ER, you've seen the worst of the worst, but you've also now are aware of like what's good and what's not. What do you think are like the common qualities of like what you would say is a respected, good plastic surgeon that you would trust your family member with? What would you say are some of the characteristics that someone should look for?
I think bedside manner goes a long way. I think when you meet a surgeon, you can tell if they care, and if they care, that it doesn't necessarily equate to being a good doctor, but that's just the first step. You know, there's phenomenal surgeons that you've worked with, that I've worked with, that aren't the nicest people, and that's fine. Yeah. But those that actually care and put themselves, put their patients first, I think that's one of the things that I always look for, even in my consultants and the people that I send my patients to. Do they care? Yeah. And so that's one thing. Second thing is obviously training, right? We already talked about, are they board certified? And that's critically important, and it has to be done. Are they board certified? And then, asking the colleagues and then asking patients, how was your experience? Did you have any complications? If you had a complication, how did he respond? Did he sort of blow you off? And that's one of the things that you'll see, surgeons will blow off patients because they want to go see the next patient. And do you feel rushed? Right?
I often tell patients when I do consultations, because I take a very long time with patients.
I can imagine.
Yeah, I'm very thorough. I spend an hour, and I'll ask them other consultations they went on, and they'll say, oh, I saw the doctor for 15 minutes. And I say, think about that. This doctor that spent 15 minutes with you in the consultation, which is so important. Like, you've spent an hour with me. You've asked me all these questions. Sure. Do you think that doctor that rushed through your consultation all of a sudden magically in surgery is going to take his sweet time and focus on your surgery and try to give you the best result? Or are they going to try to rush through your surgery just like they did the consultation? What do you think is more likely?
Of course.
And when they hear that, they're like, oh, you're right. That's a good point. Yeah.
There's a phrase I love to teach my kids. It's called penny wise, pound foolish. Have you heard that phrase?
Yes.
So, you save a couple pennies. So pounds, this is an English phrase, right. But pounds are obviously the dollars in Great Britain. And so you're penny wise, you're saving pennies, but you're pound foolish. You're not looking at the big picture.
Big picture.
And that's one of the things, like, yes, you can get cheap surgery and you can get cheap procedures all around the world. You can get them in LA in small clinics, in Van Nuys. And, so you're asking yourself, again, I don't know prices. I haven't had a boob job, but let's just say you can get it for $8,000 in Van Nuys or $30,000 and do it right. You're going to think, well, just, chances are I'll be fine. Well, that's very penny wise, pound foolish, because the possibilities that people don't understand, the complications, not just death, forget death. Sometimes you're luckier when you die. It's the patients that end up brain dead or, quadriplegics from complications, or just forget that and just cosmetically irreparable. I'm sure you've had consultations where you look and you for noses or whatever. I would love to help you, but I can't. It's just and when you get to that point, then what? Yeah. You went from trying to improve your body image and improve your overall well-being to now what? The
number of patients who have said, like, God, I just wish I had seen you first.
Absolutely. Yeah, absolutely. Yeah. And then for the most part, if you do a revision, it's just going to cost more money, more time, but just do it right the first time.
Yeah.
Right?
Yeah.
That's what that's so incredibly important. And if you can't afford it to do it right, I just wouldn't do it.
Yeah.
It's not worth it.
And I think what you were saying earlier about how when you're a doctor, you kind of can smell the BS and who's a good doctor and who's not a good doctor. I'm proud of that because I happen to have a lot of patients who are in the medical field. And I think it's because we recognize, like, okay, this is the person's credentials. This is what their training is. Oh, they served on these committees. They directed this, like your resume, right? Like, very impressive. And you're someone that obviously from reading your resume is someone that cares about their field and all that. So we see that. Whereas unfortunately, sometimes patients are like, oh, he has 1 million followers on TikTok.
Right. Yeah.
Oh,
he must be good.
I love
that one.
His skits were so funny. Oh, he seems like a really funny doctor.
Yeah.
All right. I mean, would you choose? This is the thing I say sometimes. Are you going to choose your brains? Like, if you needed heart surgery, are you going to choose your heart surgery because they have a great TikTok? Is that how you're going to choose your heart surgeon?
I'm going to certainly go into the equation.
No, right.
No, of course not.
But unfortunately nowadays, some patients are choosing doctors that way. And, I try to remind people, like, even though it's cosmetic surgery, it's still surgery.
Yeah, absolutely.
It's very serious. And like, you're entrusting yourself in the hands of someone. You want that person to take care of you in the same way that you would want any other surgeon taking care of you. This is not light. Like, this is important. I mean, the outcome is great. It's a happy field. It's one of the things I love about it. It's happy.
Yeah.
No one's coming to me because they're dying because they don't have a breast, or but it's something we're taking someone and making them happier, improving their quality of life in some way. And so, it's a happy thing, but it's still incredibly important to take it seriously.
Absolutely.
And not just think that, any Joe Schmo can do this because, how hard can it be?
No, you're rolling the dice.
There's a lot that goes into it. Well, I think you have shared tremendous advice here and insights. I think it's an incredible conversation for me because I don't often get to speak to ER doctors. Fortunately, I don't have.
Yeah, we've never spoken before. That's great.
I was gonna say knock on. We were talking earlier. I'm like, God, knock on. I mean, I think the calls I get are like, I run out of a pain pill. Thank God. Those are the calls you want as a doctor. And I think it's because good doctors. I like to consider myself one, and there's so many others here in LA that are friends of mine that I've actually had on the podcast who are the same way. And when you go to someone who's well qualified, who cares, who really puts their heart and soul into it, you're going to have a great outcome. Mm-hmm. You're going to have a great experience. So that's why I wanted to do this with you, because I want people to be happy. I want people to have a great outcome. It breaks my heart when I hear these stories like you shared or that I read about in the news, because it doesn't have to be that way.
No.
It doesn't have to be that way.
One of the things we didn't do, though, usually when I go on interviews or whatnot, there's disclosures. And let me disclose it. I did not get anything in returon. I'm not getting liposuction.
There's no bribery.
There's no envelope.
No,
and this was something that I sort of sought out because again, there, as there's just so much public misinformation. This is just one aspect of what I deal with. Obviously, I deal with a lot of different aspects of medicine as being an ER doc, but this is one of them where I see people try to cut corners. And it's just, again, the worst part about my job is telling the family that, mom, dad, whomever is dead because of a bad choice. Yeah. And so,
that's that's why we went into this field, because we want to help people. And it's interesting, the way we connected is because it was through a mutual friend. And our friend said to me, hey, I know this doctor. He's really cool. And I think he would be great on your podcast. And he's an emergency room doctor. And he was telling me all these crazy stories.
But he wasn't available. So you got me.
That's right. And then he said, there's a second choice.
Right. If he's not free, here I am.
Well, I got to say, you lived up to the expectation. You've been
it.
a great guest and a fascinating conversation for me. I think, sharing this with people is so valuable. I hope that everyone out there listens and takes some piece of this with them. And if you're considering plastic surgery, listen to our advice, because we are in this. We know the real deal.
Yeah.
So thank you for listening, and I look forward to speaking to you next time.
Thank you.
This is the Plastic Principle.